And now we have the hero of Gaucher disease at Cairo University, who is taking care and managing most of, more than 50% of all the Gaucher patients in Egypt, Dr. Khaled Abd El Azzim. So please.
So here. Thank you, Dr. Reda. Thank you, Dr. Amal, for giving me this opportunity. Thank you, Amira, for this. I'm here presenting a program that we succeeded to manage for 20 years now and more with Dr. Reda from Project Hope. Project Hope is a nonprofit organization based in the US, but has a branch here working here since the 70s. 70s, yes? 1971. Yeah, collaborating in healthcare and education. Genzyme played a very big role in supplying the treatment. We have to know that the treatment of each patient, of these patients, may cost more than $1 million a year. So we have to know that what Genzyme and Project Hope were doing to us for 20 years now. This is our hospital, our reach. Of course, many of you know it. These are the slides. I expected that the review of Gaucher disease will be reviewed by Dr. Amal and Dr. Amira, and so I will skip this because we all know it by now. This is the Gaucher clinic as Dr. Amal presented. As you see, in 2015, we have progressive or stationary number of cases in Cairo University, and those were treated through the program by Genzyme and Project Hope for free. And then the Minister of Health finally approved the right of the newly diagnosed patients to receive treatment as well. And this caused the surge in 2016 and the following years, because these treatments, this increment receives treatment endorsed by the Ministry of Health. At the clinic, the first encounter, as Dr. Amira said and Dr. Amal, usually we find abdominal distension is the major presenting symptom. Organomegaly and abdominal distension, the related hepatomegaly, splenomegaly, will constitute 70% of all presenting cases. Okay? And then we might have failure to thrive, family history, of course, some of the cases we know that they had previous cases of Gaucher disease, and then other symptoms like bleeding, epistaxis, and abdominal masses, and maybe neurological manifestations. This is the spectrum Dr. Amira talked about just before. Type 3 or neurological affection is a broad spectrum of severity. It starts from asymptomatic in type 1 until it reaches severe hydrosis fetalis and progressive neurological degeneration that may lead to death finally. And it's not responding to treatment. Type 2 Gaucher disease, as we heard, it's very severe. Brain damage, seizure, oxytonus, abnormal eye movements, hepatomegaly, and usually die by the age of 2 to 4 years, and usually the treatment is ineffective, enzyme replacement therapy. This is the case of type 2 disease presenting us. This patient is 3 years old, but as you see, he's totally emaciated, and maybe his weight was not more than 6 kilos. And this is a video that you can see he cannot move, just lying there without any ability to do anything. Type 3 Gaucher disease is a less severe form of neurological involvement. It is subdivided into 3 forms. 3A, which has severe progressive neurological disorder also, and spasticity, dementia, cerebellar ataxia, ophthalmoplegia, of course, as we heard before. Type 3B is a little bit less in affection, showing just such involvement with apraxia, and the neurological manifestations are nil. Some of our patients who receive treatment regularly since their early young age are now in their final years of school, getting high grades, and they're doing very well, except for their apraxia or the horizontal affection, horizontal eye movement affection. Type 3C is another form of neurologic involvement with characteristic involvement of cardiovascular complications. Type 3 with the ERT, although ERT is authorized for type 1 Gaucher disease only, it appears to slow progression of the neurological symptoms as well as systemic manifestations, less impact on pulmonary involvement, and not effective in cardiovascular disease until now. Improved and or stabilized neurological manifestations may be due to reversed visceral and hematological manifestations, and as well reduced systemic inflammation, which plays a very major part in the pathogenesis of Gaucher disease, the chronic inflammatory status. Now we present the program, how this program developed and how it affected and how it managed to be continuing until now with this success. First, we have succeeded to establish international collaboration. The International Collaborative Group Registry, which is initiated by Genzyme itself, in which all the patients around the world are registered with the progress, whether they receive treatment or not. So all physicians interested in Gaucher disease can learn from each other, because Gaucher disease is a very heterogeneous presenting disease. Even between SIBs who are genetically identical, they do not present similarly. So sharing information between all the physicians may lead to, actually it led to 40 publications that we can learn from how Gaucher disease progresses with enzyme replacement or other management procedures. Project HOPE, as I said before, played a very big role in this collaboration. United States expert committee who were formed from 3 of the eminent expert committees in Gaucher in the United States, who taught us everything. You will see their picture now. They taught us everything about Gaucher disease, and the Egyptian expert committee from Dr. Amal, led by Dr. Amal and Dr. Ahmed Sami Khalifa, may he also rest in peace, and Dr. Abd El and other many of our team, many physicians of our team, and the Egyptian Gaucher expert committee as well, and Sanofi Genzyme, of course, as I said before. This is the early meetings of our, in 2005, Dr. Amal and me, Dr. Layla Slim, Dr. Sumail Gawhari, and the far one, this is Katie Kowalski from Project HOPE in the US, who was managing this program. And this is to the right, this is Tommy Turney, the vice president of Genzyme, who were very devoted to the Egyptian patients and who succeeded to convince Genzyme, the authorities of Genzyme, to support Egypt in this treatment. And that's me, and this is our male nurse, Wahida, our late male nurse who passed away last month. May his soul rest in peace. He's one of the columns who built this Gaucher program with us in Cairo University. This ceremony held in the United States. These are the eminent professors. The one on the right, Dr. Mistry, and then Dr. Reda, and then Bonnie from Project HOPE. And I don't remember this one names. Dr. Reda, help me, please. Yeah, from Genzyme, but I don't remember his name because he knew to us. He wasn't there by the time. And Dr. Kolodny, the neurologist, the expert in neurology in Gaucher disease, and Dr. Grabowski, the geneticist, and Katie Kowalski again. This picture where the Project HOPE received the Global Health Award in 2017 for this program, for initiating this program and maintaining it. And this is my picture inside, in the back, and they had held there with 3 of our patients. They are 3 brother and 2 sisters, and they are all type 1, receiving treatment since a very long time. They are now graduates of college, and they are working now in first. And back in the other picture, this is Henry Termeer, the late Henry Termeer, who was the CEO of Genzyme, who was completely devoted to the Egyptian patients, and we will never forget his role in supporting our patients and giving this massive amount of drug, of costly drug, to the Egyptian patients for free. Now the international collaboration, as Dr. Amal said, there are many publications. Many of them, Dr. Amal and others from Egypt were involved. And this is the last one, published in 2017, describing the type 3 treated patients with imiglucerase. These patients collected data from 253 patients across the world. 21% of them were from Egypt alone. So we had an impact on this publication. And 202 were genotyped. 90% of them were L444P or D419H and other mutations. The median age of diagnosis, as described, was 2 years, and the median age of the enzyme replacement initiation was 203 years also. Hematologic outcomes, of course, as you heard before, they were improved. they all improved, and the visceral outcomes also were reduced, the size of the spleen and liver, no problem with it. Even the bone improved, as Dr. Amal showed us before, that score of bone density improved also on treatment. So in type 3, there was a statement, because there was always a doubt that it can affect, it is indicated in type 3, visceral hematologic and Z-scores responsive were as good or better than the 5-year outcomes for imiglucerase treated adult type 1 Gaucher disease, and nearly as good compared to pediatric Gaucher disease 1 after 8 years of treatment. So for somatic manifestations and even partly neurologic manifestations, it's indicated to treat type 3 disease. Survival also, 37 died only. Maybe without treatment, they would have all died without treatment, because it's very lethal disease. Now, and then we started to introduce advanced services like the prenatal genotyping, because it's nonsense just to continue treating such patients with such expensive treatment. So we have to do a prevention program. Dr. Samaya Gauhari started this by taking samples from the coronary villus sampling and genetically analyzing it for detecting, of course, for patients who had previous history of Gaucher disease. So we worked out this for prevention of these cases. And the objective were, of course, to prevent this the repetition of these cases. And then we had 38 of these cases with positive consanguinity, 90% of them, and the medial gestational age at sampling was 13.8 weeks. This would allow us to do abortions for medical abortions for those patients who turned to be homozygous. Of course, the carrier fetuses were 24, and some of the patients did not accept abortions later, although we had the permission of the judicial authorities. Also, our unit shared in many clinical trials. One of the eminent of them was the Encore study, which tried the oral therapy, the placement instead of the enzyme replacement therapy for the type 1 disease who are above 18 years old and stabilized on the enzyme replacement therapy. And this study was very successful. The theory of Encore, the treatment is not enzyme replacement therapy, but to get use of the remaining activity of the deficient enzyme and reducing the load of the substrate. So as you see, the normal is the substrate is, sorry. The substrate is in orange, and this doesn't work. And the enzyme activity is the blue one. And the Gaucher disease, the enzyme activity is decreased, and the substrate is very big, so the disease develops. And by enzyme replacement, we regain the enzyme activity to match the amount of substrate. But with this innovative idea that we can decrease the substrate forming in the body, so it can match with the amount of remaining activity of the enzyme in the body without enzyme replacement therapy. And this was we were involved in the phase 3 study, and we have many patients in our cases. The treatment was stable. They produced stable hematological parameters, stable bone marrow density for Z scores, and was well tolerated for 4 years. This drug developed now to be the Cerdelga, which is approved now in every country around the world almost. And 4 of our patients are now completing 7 years of treatment on this drug without enzyme replacement therapy, and they are stable hematologically and somatic manifestations. Of course, quality of life of them changed. All of them are working people now. They cannot come every 2 weeks to receive their enzyme replacement therapy to the hospital. So it's very feasible for them to just take a pill or a capsule twice a day, and it was associated without any side effects. We also shared in case reports, 2 case reports I will mention here. One of them is the cardiac involvement for the D409H. This was the first case that we saw with type 3 Gaucher disease, and started enzyme replacement at the age of 7 years. Improved somatic, of course, and hematological and skeletal, and we thought that this and he is doing okay. And then at the age of 13 years, he developed dyspnea and chest pain And unfortunately, he was discovered to have mitral valve calcification, aortic calcification, and coronaries calcification. This is the one by the side. The cardiac catheterization showed diffuse calcification of ascending aorta, the aortic arch, severe ostial narrowing of right coronary, and subtotal occlusion of the distal left main proximal parts of the coronaries. This patient unfortunately had a massive myocardial infarction during his stay in the intensive care unit preparing for a valve replacement and coronary bypass, and he passed away. This case report Dr. Amal talked about, so I will not, this is just the capability, it just demonstrates the capability of the enzyme replacement to reverse hepatopulmonary disease, which is known that it was very difficult to reverse or very difficult to manage, but we were successful to have this case. Enzyme replacement therapy is actually a chance of life. Nobody can say that it's costly because it's a chance for life. As we will see, this case I will present is the case number 1 who received treatment in our hospital in Egypt. Actually, he was a male born in 1991, 27 years. He's 28 years now. Sorry. And diagnosed by enzyme assay. His type 1 disease. This is a picture that is at the beginning of his when we met at the beginning. Because he was in another country, not here in Egypt, another Arab country. He was diagnosed as thalassemia and received treatments 3 times because he was coincidentally thalassemia trait, so he had microcytic anemia and splenomegaly, and he was diagnosed as such, as was managed as thalassemia there. When he came to our clinic, we diagnosed him by the aid of Dr. Amal Bishlawi and Dr. Azza Mustafa. We were able to diagnose him as Gaucher disease for the first time, as a case of Gaucher disease type 1. We worked hard to provide him with treatment, and we succeeded to have his treatment endorsed by the Genzyme. These are pictures when he was growing up. Meanwhile, he first received the Ceridase, which was the placental extract, and then he shifted to the Cerezyme, which is recombinant. Both were produced by Genzyme. This is his weight and height progresses through the years, since 1 year before starting treatment until it finished, and as we see, it develops right. This is much more important, interesting graph, because here we see his height just touching the -3 standard deviations, and with treatment he started to jump and catch up process until he reached the median age of normal for his age. And this is one he likes scuba diving. Actually, this is his platelets and hematology parameters. The organ volume also decreased, and 20 years now married, having steady work, feeling grateful with an eye toward the future. That's all the story about enzyme replacement therapy. And thank you very much.
Thank you very much, Khaled. You presented our great experience for Gaucher disease and the great hope for these patients to live very good with the enzyme replacement therapy, Cerezyme. And I think that you can have some idea to diagnose Gaucher disease now in a case of anemia, hepatosplenomegaly, thrombocytopenia. You have to think of Gaucher disease. Any question? I want only 1 or 2 questions in order to go to the coffee break, because I know that now we are hungry, you are thirsty, and you want to escape. If there are any burning question, we are ready, the panel is ready to answer. No question?